Bismillahir Rahmanir Rahim. Welcome to the Khyber Medical Academy. So guys, today our topic is on scabies. As you know that scabies is related to the dermatology, and you also know that scabies is a common disease which affect over all age of people. So first of all, we define that what is scabies. So scabies is caused by a microorganism. Scabies is caused by a microorganism, which is given name is Sarcoptes scabies. Scabies caused by microorganism which called Sarcoptes scabies. So scabies is in gender two type of gender, male and female. There are two type of Sarcoptes scabi, which is male and female. Male is destroyed. Male destroy their self after fertilization. And female enter their self to superficial layer of skin, which is stratum corneum, and where they release 15 to 20 eggs, which later these eggs convert to converted to mature Sarcoptes scabiei. So, okay. Sarcoptes scabi is in two type. Male is destroyed after fertilization. I mean, when fertilization occur, the male Sarcoptes scabiei destroy their self, and the female enter their self to the superficial layer of the skin, which is called stratum corneum stratum. That is the superficial layer of the skin. In the skin, the female Sarcoptes scabi enter their self through the legs. This is the legs of the Sarcoptes scabi. That is the leg of the Sarcoptes scabi, and through these cilia they move their self, and through this leg, through this leg, Sarcoptes scabi burrow in the stratum corneum layer, which is superficial layer of the skin, and after the burrow they enter their self in the skin superficial layer, which later they release 15 to 20 eggs, and after 3 to 5 days these eggs converted to mature Sarcoptes scabi. So now we discuss on the pathophysiology of the what of the Sarcoptes scabi. Pathophysiology. Pathophysiology means how is the process through which Sarcoptes scabi enter itself to the skin. So female Sarcoptes scabi. So for example, this is our skin. This is our skin superficial layer, which is called stratum corneum. So this is the female types of Sarcoptes scabi. So this Sarcoptes scabi enter to the superficial layer of the skin, and boro means pores. These like pores through their legs. So bore their bore in the stratum corneum layer of the skin, and after the bore enter to our skin, and after the internalization they release eggs 15 to 20 eggs release, which later these eggs convert in mature Sarcoptes scabi. And especially they borrow their self and enter their self at night time, and therefore the nighttime itching is increased in the body. So now after the pathophysiology, now we talk about the clinic of the scabies. That what is presented in clinical feature. So clinical feature first of all present, which is mostly present, is itching, which more in night, especially in those area where rays of sun light not approach, e.g. for example between finger, buttock area, and axillary line, axillary area, chest. So these area mostly affected by Sarcoptes scabies, because where sun rays or light rays is not approach easily. And in difference between adult and children, in adult itching occur below head and neck. And in children, itching area also contain head and neck. So that is the different and the children and adult. That itching occur mostly in the children, is affected by neck and head, but while in the adult, head and neck is not contained, and itching not occur where. So that is the different in the children and adult. Now we discuss the treatment. So the common and best which is used for the Sarcoptes scabies is permethrin 5%. Permethrin 5%, and permethrin 5% is the best for adult and children. Otherwise, we used tab Rigix 10 to 25 mg. Use it night because it is sedative. Night use. If the scabies is in the severe condition, so if the permethrin and Rigix is not result and not cover with the permethrin and Rigix, so then we use tab permethrin, sorry, tab avermectin, that is in the severe scabies, but it's not used in pregnant mother. Okay, permethrin is lotion through which we bath. So that is the treatment of the scabies. Treatment of scabies, and that is the whole study about the Sarcoptes scabies. Is any question about the scabies?
Why it is increased at night time?
Yes.
Another question is why it occur in children above the head region and not occurring adult at
Okay,
the head.
okay. The first question is why it increase in neck area. Why it is increase in the night? Night increase. So therefore it increase in the night. Night, first of all, histamine increase in night. That is one point. Second point is due to off of light, these microorganisms easily borrow their self. So in cause of more itching. First of all, in night time, the histamine level is increased, and the second reason is these microorganisms can easily borrow their self at night time because these Sarcoptes cabai is sensitive to the rays. So in daytime, it cannot borrow their self in the stratum corneum layer. And the second question is why increase head and neck itching in children? In children, in children. In neck and head area of the children where keratin level is decreased. So due to hypokeratinization, the Sarcoptes cabai can easily borrow their self-wear and can cause of itching. And in adult, head and neck area are more keratinization. So due to more keratin level in the head and neck, Sarcoptes cabies cannot easily borrow their self. So therefore, that is the big difference in the children and adult, that the keratin level in the head and neck more in the adult and decrease in the children. So that is the big difference in the children and adult. Any question? Okay, thank you.